All right, everyone, we're going to get started. This is session 10, exercise versus airway clearance in the era of highly effective modulators. I hope y'all are all in the right place. Can y'all all hear me? Somewhat hear me. Okay, I'll let our tech team figure that one out. But yes, I hope y'all are all in the right place. This is session 10, exercise versus airway clearance in the era of highly effective modulators. I also want to say a special welcome to everyone who's joining us online on the live stream. I'm proud to be moderating this year alongside Melissa Richmond from British Columbia Children's Hospital in Vancouver. Melissa graduated from the University of British Columbia with a master's degree in physical therapy. She joined the CF team first by working in the inpatient setting and then the outpatient CF clinic. She has experience with clinical research, including adherence studies and multiple breath washouts. And then I am Jennifer Wazell. I go by Jenny. I graduated with a doctorate in physical therapy from Texas Women's University and have been part of the CF Center in Central Texas for the last 3 years. My research is focused on exercise as a part of the treatment of the individual with CF, along with body composition studies. Neither Melissa nor myself have any disclosures for today's presentation. So today's session will be a pro-con debate on airway clearance and exercise, asking our presenters to state their case on one side or the other. These are the objectives for the debate, and now Melissa will give us some more background information.
So before we get started, and in order to allow us to select a winner, I'm going to ask you all to cast your votes. So everyone take a look at the slide here, or go to slido.com and enter this number. And then I'm going to switch to the live results in just a moment, and I'll give everyone a chance online as well. Hopefully this wasn't too soon, but you should still be able to join from here. All right, so what team are you on? Exercise, airway clearance, both, or I still don't know. So I'll give it a moment to settle as you cast your votes.
We don't need to do it.
So we have 150 votes registered so far. All right, are we going to hit 200 voters? 200 voters, okay. We'll let it settle for a minute. Maybe someone can capture this for later. So we know. And it looks like our debate teams have their work cut out for them. So I'm going to switch back to our slides for a second. So before we get started and before we introduce our speakers, and provide some disclaimers for the event, I'm going to provide a brief but neutral introduction. So for all of us that work in CF, we know that some of the thoughts and practices change well before our standards of care and clinical guidelines change. In the last couple years, with the onset of CFTR modulator therapy, the CF Foundation, as well as the European CF Society and CF Canada, have started or completed some rigorous work around the standards of care in the new modulator era. Airway clearance has been one of the main pillars of cystic fibrosis treatment for many, many years, and exercise has been recommended as advantageous for all people with CF. The debate between exercise and airway clearance has existed for a long time. However, things are changing and the question has arisen again. Can exercise replace airway clearance in the new era of CFTR modulators, and what are the current recommendations? In 2009, the CF Foundation recognized it as important that people with CF should perform airway clearance to maintain lung function and improve quality of life, and exercise should be used as an adjunct to airway clearance. This standard was reviewed in 2021 and no change was needed. Just this year, the European CF Society recognized that this is a priority research area, but continued to acknowledge the importance of airway clearance. And CF Canada, in a supplementary document that was developed by the Canadian CF Physiotherapy Advisory Group, recommended ongoing regular airway clearance as, again, more evidence is needed. So the question remains, are the tides turning? Are people with CF voting with their feet with respect to airway clearance? There were 2 key surveys completed in the last few years that will will be referred to by our presenters today, completed in Australia and the UK, that look at the current practices and opinions around airway clearance for people with CF. And I'm going to introduce you to these papers from a neutral perspective. So the Australian study completed by Nathan Ward surveyed 692 adults with CF around their current use of airway clearance and exercise when they were both unwell and well, and it looked at their beliefs regarding the use of exercise as a substitute for traditional airway clearance. Similarly, the study in the UK by Nicola Robotham surveyed 480 individuals in the CF community, including healthcare providers, their families, and healthcare and people with CF. So, the reported exercise frequency in both these studies was that the majority of people surveyed are exercising 3 to 5 days a week or more. And these surveys also showed that people with CF are doing their airway clearance once or twice a day, with the minority group who is doing none at all, nowhere close to that of the majority. So the Australian study showed that a large percentage of people surveyed agreed or strongly agreed with the statement that exercise can be used as a substitute or alternative to traditional airway clearance. And the UK survey reported that over 50% of all respondents may drop their prescribed airway clearance often or sometimes if they've exercised. 73% of the healthcare providers surveyed in the UK indicated that they would support a trial of replacing some or all airway clearance techniques with exercise. But just because people believe or want exercise to be used as airway clearance and have done it before, we need to rigorously evaluate the evidence on both sides, and thus the reason for the debate today. So without further ado, I will pass it over to Jenny to introduce our debate teams.
All right. So on Team Exercise, represented in blue today, are Lisa Morrison and Karen Vonberg. On the other side will be Team Airway Clearance, represented in red, and includes Gemma Stanford and Claire Smith. First up on Team Exercise is Lisa Morrison. Lisa is the principal physiotherapist at the West of Scotland Adult CF Centre in Glasgow. She has worked in CF care for 29 years, encompassing both pediatric and adult care. Lisa has participated in the development of local, national, and international guidelines into various aspects of CF care. Lisa is currently undertaking a PhD, exploring the role of digital health technologies to support the future care of people living with CF. Also on Team Exercise today is Karen Vonberg. Karen Vonberg has worked with children and adults with cystic fibrosis at the Johns Hopkins Hospital for over 20 years. Dr. Vonberg developed the outpatient physical therapy program at Johns Hopkins CF Center and enjoys mentoring PTs from across the country to help optimize their role on the CF care team. She has presented at national and international conferences and has provided university lectures and continuing education courses on the role of physical therapy in CF care. Now for Team Airway Clearance. Gemma Stanford is a highly specialized physiotherapist in the Adult Cystic Fibrosis Center at the Royal Brompton Hospital in London, where she has worked since 2005. She recently completed a PhD, which investigated outcome measures for airway clearance in adults with CF. Gemma is the lead coordinating investigator for the current Yoga CF trial, which investigates the effects of yoga on adults with CF. Gemma is the chair of the European Cystic Fibrosis Society Physiotherapy Specialist International Interest Group, there we go, and part of the International Reach for CF collaboration. And finally, our last player on Team Airway Clearance is Claire Smith. Claire has worked extensively in CF for both pediatric and adult centers. She currently works at the University of Calgary Adult CF Clinic, where she provides inpatient and outpatient care. She has a special interest in research and research ethics and is the CF research coordinator at the University of Calgary. She is an active member of the Canadian CF Physiotherapy Group and is also a member of the CAN Act group working to increase clinical trial activity in Canada. These are the disclosures for our speakers today. All right, so in the style of famous battles in the past, Pepsi versus Coke, Marvel versus DC, Holyfield versus Tyson. Today is exercise versus airway clearance and cystic fibrosis. So some disclaimers before the debate gets started. First, slide colors have no affiliation with political parties. The views expressed do not necessarily reflect the opinion of the debater. We asked that they defend one side regardless of their personal opinion, and they ran with it. So with that in mind, debaters, be polite. This is friendly debate. We sought we sought international representation with the United Kingdom, United States, and Canada being represented today. So each team member will have 15 minutes to defend their stance, and it will alternate between exercise and airway clearance. Following the initial arguments, there will be a rebuttal for each member, and finally, directed questions from us, your moderators. We are going to do all Q&A at the end, so please use the app to ask your questions as we go so you don't forget what they were. We tossed a coin to see who would go first, and it is Team Airway Clearance. So our statement to be debated today is, be it resolved that airway clearance cannot and should not be replaced by exercise. Here you go, Claire.
I'm very short. I can barely see over the laptop. So Jenny and Melissa, thank you very much for inviting us here today and the organizing committee. It's really great to bring back the pro-con debate. I'm going to come straight to the resolution. And I think there's a lot to be said in this statement. There's should not, there's cannot, and then we really need to talk about the era of highly effective modulators, and I think that that is where we'll start. This is a really big statement, but it's going to ring true. So highly effective modulators, we really do need to consider the space that we're currently working in. This era has brought tremendous benefits to people with CF. The phase 2 data of the VX445 ETI studies showed increase in FEV1s of around 14%, drops in sweat chloride, 40 millimoles, improvements in BMI and CFQRs, and we have wonderful increases in median age of survival. This paper by Lopez et al. Showed a predicted median survival of 71 years in those that are delta F homozygous and on ETI. That's a 33-year increase over basic care. However, I'd just like to plug the Canadians while we're here. The median age of survival in 2022, the most recent data for Canada, was 60, and that's for all comers, not just people with delta F or on ETI. Go Canada. But we do need to recognize that ETI is not available to everybody, whether it's due to genotype being considered non-responsive, whether it's related to your country level approvals, whether it's related to your country level restrictions around FEV1s, or if it's related to adverse reactions. This disparity is creating a wider and wider gap in health outcomes. Now, while we do need to remember the ineligible population, and I am going to come back to this, we need to clearly understand that airway clearance remains an essential service for those on modulators because there are significant pulmonary manifestations that we need to be addressing. So there's been some really good post-market literature, the PROMISE study, the MODULATE study. Here is some of the data from, I'm going to just use the pointer, from the German group, and you can see there's a significant drop onto in sweat chloride, going from baseline onto Tez-Iva and then further onto Alex Tez-Iva. And you can see this same drop in sweat chloride for the delta F min function group as well. However, when you look at the delta F homozygous group, that median falls around the 30 millimoles. So that's great. But there is a difference in these two groups. The median in the delta F min function group, that median's falling around 50, which still is within our indeterminate range. This is more work from the German group of Dr. Markus Moll. Let's move it on. This is the global MRI scoring, and you can see with the delta F homozygous group and with the delta F min function group, there are significant drops in the global MRI score on ETI. You can see this clearly in before on their imaging and after on their imaging. So it keeps flipping on me. Even though there is a significant improvement here between your pre and your post, there's still a significant amount of irreversible lung damage. And once again, it's showing how clearly we need to have ongoing airway clearance. I'm going to talk specifically to the PTs and RTs in the group because we are the airway clearance experts. And we're going to look at some of the sputum properties. Here again, you can see that there is a drop in the viscoelastic properties of sputum from baseline to 1 month, 3 months, and 12 months on ETI. You can see here, there's the healthy microbiome and how through being on ETI, there's a trend towards normalization of the microbiome. But all of these properties remain clearly abnormal. And as the authors suggest, at best, they can be said to be nearing the realm of the non-CF bronchiectasis population. There are similar findings from different groups around the world, from David Nichols and his U Washington group, from Mark Murphy and his Irish group. So these are reproducible studies. Here are a couple more articles that talk about how there's a body of evidence that different mutations or different combinations of mutations have a varied response. And even if they meet country-level approvals for coverage, it speaks to the ongoing need for an expert CF clinic personnel to manage the nuances. So to summarize this science nerd section, we still have damaged airways. We have ongoing abnormal ion transport with sweat chloride in the indeterminate range. We have ongoing abnormal sputum viscosity, inflammation, and infection. So even though we have more space to breathe, there's work to be done. I said I was going to come back to the ineligible population, and I believe many people will have seen this type of graph or slide. There's definitely a tale of those who have and those who have not. So specifically with low to middle income countries, they have a significant population of CF patients, such as Central America, South America, India, the Middle East, and South Africa. And given that the global demography of CFTR mutations is largely determined by race and ethnicity, this results in people with CF in these middle to low income countries being further marginalized. So I would like to suggest this is further showing that even in the era of ETI, there's a need for the expert CF care team, skilled practitioners in airway clearance, and the knowledge of our collective PTs and RTs cannot be lost. So let's talk about that expert knowledge. Attendance at a specialist CF clinic in Europe, the US, Canada, Australia is recommended in all of the relevant guidelines in order to provide our people with CF an enhanced standard of clinical care. That expertise can only be achieved through repetition, reflection, feedback, and the ability to change in changing environments. We know that habits take about 10 weeks to be solidified. This is well documented in the psychology and behavioral science literature. But we also know, as airway clearance professionals, our knowledge needs to be used regularly to be remembered, and our teaching skills need to be honed. These are things we cannot lose. And even more importantly, I think our patients need to create those habits. It's too late when they're sick. They're not at their best, they're fatigued, they're overwhelmed. It is not the time. Just keep looking at that, just keep looking at that. This is not a time to be trying to remember things that you haven't been using. So thank you, Lisa, for writing the standards of care. This is the European CF Society's 2023 guidelines. And in this section on airway clearance approaches for the productive patient, during an exacerbation, it is important that people with CF can competently perform airway clearance, since the person with CF may have increased sputum load and reduced energy for exercise. These standards, I'm just gonna throw it at Lisa here. These standards also state in the physical activity and exercise section that adherence to exercise is often poor. So for a final word on this, before I hand over to, I think Lisa's coming up next to respond. I'm gonna be late as we go. I'd like to just have a little patient perspective. This is Nikki. She's a person with CF, an advocate, a philanthropist. She's donated more than $4 million to CF through her organization, Summit Foundation for CF. She's been on the transplant list for 10 years. She has an FEV1 of 26%, and she works really hard to stay healthy. She's been on Trikafta for 18 months now. Her FEV1 is 32. And if anybody'd like to read more about Nikki, they can follow that link. Hopefully the video works.
Hi, my name's Nikki. I'm 52.
Let's start again, see if we can have some volume.
I have cystic fibrosis. And I just want...
Hi,
my
me.
name's Nikki. I'm 52. I have cystic fibrosis. And I just wanted to tell you what the secret to my success is. And that is an exercise routine and a flutter routine. Both of these go with me wherever I go. The reason I think it's so important is because exercise loosens the mucus from the walls of your chest, right? Gets it loose. But the flutter, it pulls it up so that you can spit it out. And that is the best way to get rid of these secretions and keep your lungs clear, especially with those of us lucky enough to be on Trikafta. That means we still have to do what we gotta do, because it's not a cure, but having an exercise routine, it can be anything: walking, CrossFit, rowing, jumping, stretching, yoga, Pilates, whatever you can do, successfully do, and you're flooded. That's it.
Sounds like she likes exercise.
Sounds like that doesn't do everything for her.
Now we're going to hear from Team Exercise, and I should let you all know that they didn't share their slides with each other prior to this, so authentically surprised.
And just in case you forget, this is who you vote for. The 11% of you who didn't vote, this is how you vote. Thank you, Claire, thank you, Jennifer and Melissa, for inviting us to debate today. And thank you for a wonderful talk, Claire, and for Nikki, who obviously advocates exercise as well as flutter. But hey, we'll come to that. So here we are about team exercise. These are the things that I'm going to outline. I'm going to talk to you about exercise as an airway clearance. I'm going to tell you a little bit about how it improves lung function, how it changes sputum rheology, reduces morbidity, increases life expectancy, improves exercise tolerance, which, as we know, has a massive impact on mortality and morbidity, but really that it's become a standard of modern care. And I think that's what we've got to remember. We can't think about the past. We have to think about the present and the future and modern care. So, exercise, the physiological benefits. What are they? Well, we've known, and I need to highlight this to you, apart from Thomas Radke's paper in 2024, all of these other papers are more than 20 years old. So Nixon in 1992 told us about the benefits of exercise and how that improves morbidity and mortality in people with cystic fibrosis. Again, supported in 2019 by Heberstreit et al., who said exactly the same thing and said if we're physically fit and exercise well and our VO2 max is 80% or more, we can live, or people with CF can live for 8 to 15 years longer than those who don't exercise. And this is history. This is not in the era of CFTR modulators. So I think that still applies to those people who are not able to access CFTR modulators. Much as obviously we're very keen for them to have access to modulators, we can still provide exercise for them that is going to improve their lives. And also, coming back to Maggie, what did Maggie say? She said that breathing techniques and exercise actually together combine to make it better. But you had to add the exercise in to get that additional benefit. Exercise interventions are effective in improving muscle strength and respiratory muscle function. So not just lung function, we're talking about whole body functions. We can improve in cardiovascular capacity. So all about the exercise. And again, still 24 years ago, this showed that 3 years of exercise and a follow-up of 3 years, where most of the 65 subjects had a minimum of 2 years follow-up, demonstrated with self-selected physical activity that actually they slowed their rate of decline in lung function. Again, before CFTR modulators. So this exercise has been a mainstay of physiotherapy management for many, many years. This is not a new concept. We haven't come to this. We've been developing this for many, many, many years. And in this study, compliance or adherence to exercise was demonstrated to be higher than any other form of physiotherapy. So I think that also is a key and a valuable thing to remember. And coming back to the flutter, well, Tiffany Dwyer, excuse me, has done a lot in terms of exercise and looking at how that benefits the person with cystic fibrosis. And in both of these studies, she has shown that exercise was as effective as flutter or PEP at augmenting airway clearance from the periphery and the central airways. So even a single bout of exercise was better at clearing the mucus than flutter. I'm sorry, Nikki. And treadmill exercise led to a transient improvement in sputum hydration. And we all know that if we hydrate the sputum, it's easier to clear. And again, coming on to secretion management, again, thank you, Tiffany. I mean, Tiffany's done a lot of my work for me, as did some of the guys earlier in this room. But Tiffany also showed that exercise improves ease of expectoration. You take bigger breaths, so ventilation and respiratory flow were higher with exercise than they are with just airway clearance. And it also changed sputum rheology or viscosity, making sputum more easily expectorated. And Alexandra Heberstreit also showed that nasal potential difference was now I always get this bit wrong, was an increase in negativity of the nasal potential difference, which means at a cellular level, we're influencing the tenacity and the viscosity of sputum. And maybe that's why exercise is beneficial. And just not to harbour a point, but this was before CFTR modulators. Coming back to the subject that that Melissa pointed out earlier on, again from the Australians, almost half of people with cystic fibrosis were using exercise as a substitute for the traditional airway clearance. So I think that people are already deciding, and this was self-selected, this is not by our physiotherapy or our other multidisciplinary team colleagues saying, you can change now, you can swap stuff in. They've been actually deciding themselves that this is what we want to do. And we all know when we care for people with CF that choice and preference is pivotal to get a person on board when you try to implore them to do something to clear their chest. So for me, if people are voting with their feet for exercise, then we have to support them to find the optimum exercise that's going to get their chest as clear as possible. So can exercise replace airway clearance? And this again was Nicola Robotham that Melissa referred to. And again, as I said, most people with CF are already incorporating exercise into their lives, which is great. Almost half of them regularly omitted their prescribed airway clearance if they have exercise. So when they're time limited, and again, people with CF, because of CFTR modulators, and also previous to that, because that they had a better medication, better MDT approach, wherever they are in the world, we're a better, stronger MDT because of what we've learned in the last 20, 30 years, that they've been getting better anyway. So if they're time bound, so they have gone to university, they've gone to jobs, they've got families. So if they're time bound, they don't have time for exercise and airway clearance. So they choose exercise because it's a bit more fun. And 73% of healthcare practitioners would support a trial replacing airway clearance with exercise because we think that we can get people with CF to behave like the non-CF person. And pretty much most of us, I would say, in this room would have some exercise in their lives because it's what's expected of us. And again, most of these respondents were the UK and US, but there was a quarter from elsewhere in the world. So this is not just representative of us, it tends to suggest there is a global trend towards exercise in the CF population. We've seen again from Nathan's study, why do people exercise? Why do you or your child with CF exercise? And you can see here, because of lung health. They know that it's better for their lung health to actually exercise. This is the biggest one. How do I show this? The biggest one was with improving the lung health, and they get better sputum production and they feel better if they exercise. So, I mean, what can we say? That's what the patients are telling us. And when you compare people with CF to their healthy peers, 16 studies looked at this as part of a systematic review, and the CF population were as active as their healthy peers. When you analyse that information a bit further, they perhaps didn't do as high intensity activity as their peers, but they did have more low intensity activity. So they were beginning and starting to establish habits of exercise. So give them 6 to 8 weeks and they'll have a really good exercise programme on board. So what are the positivities associated with physical activity in people with CF? And these are the objective ones, the ones that we can measure. Slower lung function decline, reduced hospitalisation. We're seeing that in our patients on CFTR modulators. We have many less patients in hospital now than we did, which is fantastic. And those that do come in tend to be those that are a little bit sicker and perhaps need a little bit more guidance and advice. They have an improved quality of life, so they're able to get out and about and do a little bit more, and maybe even have different goals than they had 10 years ago. Their nutritional status is improved, so they feel better, they want to exercise. And there's improved prognosis, as we've highlighted from Claire, who kindly showed us about the 71% and how well Canada are doing. Well, we're all going to follow that lead. So if CFTR modulators can do anything, it will allow people to perform more physical activity and make other therapies less time-consuming and burdensome. We have seen the standards of care highlighted, but it's also important to pull out the other things in there, which says physical activity and exercise should begin at diagnosis. It should be individualised and allow people with CF to self-manage. They should have a standardised exercise testing, which should advise advice and support and guidance for a physical activity programme. And CF teams should support people with CF to be physically active and exercise regularly. And also, we've heard that Gemma is doing a yoga study. Oh, okay, that's interesting. So, and others are now engaging in exercise, exploring specifically why exercise and what duration of this is equivocal to airway clearance and exercise. So Gemma's not doing an airway clearance one now. She's done that. It's past, it's history where she's focusing on the future. We're going to exercise and yoga. And our patients with CF are also asking us in our clinics, how hard can we push ourselves? They're being more specific in their exercise questioning. How can I use this stronger body? How can I live longer stronger for longer? And how can we use physical activity to change our body composition and improve their body image? Because they're all dealing now with some of the same symptoms, same issues that we have. Is if we eat too much, we don't exercise, we don't necessarily like what we see. So this is what our patients with CF are coming to us to ask about now, and how to learn and how to use that body that's been improved for them. So the exact CF study, just briefly to tell you a little bit about this. This is looking at exercise as an airway clearance compared to traditional airway clearance techniques. And there are a lot of physiotherapists were asked about this, what the frequency, duration and intensity of exercise should be that was equivocal to an airway clearance session. So a lot of this was, there was a Delphi study to look at this, and I can't remember the specifics, but I think there was 70% of the participants were physiotherapists, so it's very much a clinically driven comparator, if you like. So what kind of exercises can we do? And they talked a little bit about HUF and how that might help, but there was no evidence base for the HUF, so we'll kind of like slide that on the carpet. But we have looked at the exact CF study, and in the ECFS, Don Urquhart reported on the feasibility study of doing exact versus tact or traditional airway clearance techniques. And patients said they wanted 67% of patients wanted choice to be able to choose exercise as an airway clearance. And I think that, again, is really important. As we know, our patients demand choice. And if we give them, to a degree, what they want, then they get what they need, and they're on board with us. So I think that's something that we really need to remember. So, in summary, what are the physical benefits of exercise? Improved muscle mass, strength, bone health, body composition, cardiovascular health, exercise capacity. What does it take away? It takes away CF-associated risk factors, and Karen's going to tell you a wee bit more about them later, but we're talking about bone mineral density and things like that. It reduces the rate of decline in FEV1, and it reduces sputum retention. And it's been improved, it improves exercise capacity, and that higher aerobic exercise capacity has been linked with survival, which is fantastic. And it's likely to remain a component of the CF therapy regime, even in the age of CFTR modulators, when airway clearance will kind of be dropped, I think. So, coming back to the 2022 Cochrane review, they didn't find any evidence to suggest that exercise was better or worse, but exercise did improve people's exercise ability, and it was the preferred choice in one study. And none of the studies reported any negative effects of exercise therapy. Whereas we know sometimes airway clearance causes bronchospasm, pee in yourself, those kind of horrible things. So, and going to the ACP-CF, which is the Association of Chartered Physios in CF in the UK, and this is the 2020 guidelines, which we are currently publishing the 2024 guidance, and hopefully that'll be out before the end of the year or beginning of next. But key points: physical activity and exercise, part of the routine management. There's significant health benefits for a physically active lifestyle, and a recommended exercise programme is pivotal. Exercise programs must consider motivations and goal setting. It also can be used in any severity of disease, and I think that's really important, because we can get people who have low lung function to exercise as pulmonary rehab as a prequel to their transplantation perhaps, and or after their transplantation. And we need to try to minimise barriers to being physically active, and minimise the time spent being inactive. A structured exercise programme now is offered to people who have musculoskeletal disorders. And because of CFTR, and because more people are exercising, we are seeing more musculoskeletal issues. So I think that's important as well. And it's all exercise related. So last point, exercise is fundamental. And I thank Karen for the fundamental part of it. So we're all exercising, and this is what I do. So I'd just like to stop there. Don't waste your vote. Vote for team exercise.
Okay. So we'll just get some slides up, and I think you're about to see a class in interpretation of research, let's put it that way. Okay, so first of all, I'm going to start with a few disclosures. Thank you, obviously, for everyone who invited me to be here. So my disclosures, yes, my PhD was in airway clearance. Yes, I have looked at airway clearance a lot, and yes, I do that. And yes, I am the lead coordinating investigator for the Yoga CF trial. And that doesn't mean that I throw airway clearance out of the window. It just means I'm open to asking questions, and I'm open to looking at evidence and getting real good evidence for what we do. And I very firmly believe in this quote, which, it's by Lisa. Airway clearance techniques are a crucial component of CF management. And I will hold that throughout this talk. 2023, by the way, that would be post-modulators, just to mention. Okay, so what am I not debating? What we've heard from Lisa is an amazing evidence about exercise. And quite frankly, yeah. I mean, if that was what they'd asked me to debate, I'd rather go shopping. Like, that is a given. So I'm not here for that. I'm also not going to debate if airway clearance techniques are being replaced by exercise, because as we've heard in the introduction and from Lisa, yes, they are. And we know that from our clinics. We walk in the clinics, we talk to our patients, we know that they're voting with their feet. But that doesn't mean that it's the best thing that we can be advising for our patients. And I think that's what we need to remember as clinicians, is just because somebody else is deciding to do it, doesn't mean we have to roll with it. You know, we need to decide what's the best evidence and try and help our patients. Also, this is a little bit of registry data. So this is the UK, Canadian, and US data from 2019, so pre-modulators, and 2022, so post. And you can see that the percentage of people reporting exercise as their primary airway clearance is really low. So actually, you know, it's below 10% in the USA and Canada, and it's only about 18% in 2022 in the UK. And actually, that's dropped to 17% for the 2023 data that I was sent yesterday. So our people with CF are very, very smart. And there are very few of them that are saying that exercise is their primary airway clearance. And there's got to be a reason for that. So what am I going to debate? I'm going to debate this. Be it resolved that airway clearance should not and cannot be replaced by exercise. Now, I looked up replace because, you know, it's good to know what you mean. And we're going for take over, succeed, supplant, take over from, or change. So what I'm basically going to debate is, do exercise and airway clearance do the same job? Now, if we go to our basics and think about the aims of airway clearance, and Claire has very nicely already told us that actually that bronchiectasis, that mucus, that damage, it's all still there in a lot of people, even on these modulator medications. So we want to decrease our airway obstruction and resistance, and we want to increase our ventilation and airflow to delay the disease progression and maintain optimal respiratory function. And that's through mucus mobilization and clearance. Remember the and clearance part of that. And our guidelines, so this is the US guidelines and the brand new ones that obviously we know Lisa wrote, they put airway clearance really highly within their standards as something that we really need to have as a firm part of our physiotherapy management. And we've got an awful lot of airway clearance techniques out there. And quite frankly, I could stand here for the next day and debate which one's better and what's the evidence and what's the problems with the evidence and blah, blah, blah. I'm not going to do that. But what I am going to show you is there's a reason that exercise has got a question mark, and there's a reason why I'm going to put a big fat cross by it, because that one does not count as an airway clearance technique. So let's go to some basics. Let's go to the physiological principles of airway clearance techniques. Back to, university days. What do we need to do for something to be classified as an airway clearance technique? We need to increase those tidal volumes. We need to take some deep breaths. We really want to utilize collateral ventilation, so we want to be able to bypass those plugs of mucus. We want to open up those other channels. We want to get behind the mucus and start moving it up and out. And the way that we do that is with our breath holds, by letting those other channels open up. We want an expiratory airflow bias. We want to breathe out more than we breathe in so that we're helping to push that mucus up and out of the airways. And we want to utilize that equal pressure point. We want to use the airways to push the mucus up towards the mouth. And we also want to add some mechanical stress. We want to shake up those lungs, we want to shake up that mucus, we want to get it moving. Now, if you think about exercise, I would say there are very, very, very few exercises that include a breath hold. There are very, very few exercises that have an expiratory airflow bias. And I can't really think of any that have an equal pressure point. So you might increase your tidal volumes and you might shake it up a bit, but your fundamental other principles of airway clearance will not be ticked with any exercise. So I do get asked quite a lot, but could some types be airway clearance? You know, just try this one. And running's a really key one because people kind of go, oh, you know, well, I breathe a lot running. So this is my son running. He's not a runner, he's a football player, but he promised to run for me. And you can see that when he runs, he is breathing out quite a lot, he's breathing out quite hard, but he's also sucking air in quite hard. So his expiratory airflow bias is not there. He is increasing his tidal volumes, and he is shaking himself up running about, but he definitely hasn't got any kind of equal pressure point, and he definitely does not have a breath hold. And then, of course, you know, running the yoga study, I get asked, what about yoga? Quite a lot. And somebody just the other day happened to help me out with this one. So this is one of my Yoga CF participants. I did yoga for years, but never thought about my breathing at all. It was all about doing the movements. And I think quite a lot of people with exercise, even with something like yoga, unless you really kind of tap into the ethos and work with the breathing, you could just go through the fundamentals of moving because, oh, it's exercise and it's good for me and I'm moving my body. But actually, unless you get really into kind of thinking about the breathing, even something like yoga could not work in terms of changing your breathing. So if we go to the evidence, if we look at exercise or airway clearance versus rest to start with. So we know with airway clearance that more sputum is cleared with airway clearance than with no airway clearance. And we also know that more sputum is cleared with airway clearance than with cough alone. When we go to exercise, Tiffany Dwyer's told us that ease of expectoration improves after exercise compared to rest. And then Kremler et al. Showed that the volume of sputum cleared increases during airway clearance after exercise. So nobody has said that airway clearance, that exercise increases sputum coming up. It makes it easier, and it makes it easier to clear when you do your airway clearance. But nobody has said that exercise alone is better than rest. Oop, let's go the other way. And then when we look at that peak expiratory and expiratory flow, so this is from Nathan Ward's systematic review in 2021, and you can see that the expiratory and inspiratory flow rate ratio favours exercise over rest. So exercise does enhance that flow rate. But then when we start looking at exercise versus airway clearance, what do we get then? And first of all, we've got Tiffany Dwyer's work again. Obviously, Lisa's mentioned this already. She looked at treadmill versus rested breathing versus flutter in 24 adults. And she showed that the respiratory flow, the only thing that improved that flow rate, so that expiratory flow bias, was the flutter. The treadmill had a higher peak expiratory flow rate, but you were also breathing in really hard as well, so that ratio wasn't any good. It didn't enhance clearance at all. And Nathan Ward obviously summarised this one as well really nicely for me, and it favours airway clearance. Tiffany Dwyer then went on to look at the mucus cleared. Again, obviously we've heard from Lisa on this one. Treadmill versus rest versus PEP. 14 adults with CF with a huge range of disease severity. And this is a really nice graph, and it's slightly tricky to look at, but it's worth having a really good look at it. And what it showed was that in terms of the whole lung, see if I can show you on the thing here, the red line, that's PEP going down. So PEP was better than treadmill and control, which is at the top. So more stuff was cleared with PEP. When you get to these intermediate and peripheral regions, it's a bit more similar. But when you look at the central region, down here, this is PEP, right at the bottom, whereas the control and the treadmill are together up here. So what she concluded was that PEP was better for overall clearance of mucus, and especially from these central areas. And the main study takeaway was always to include hoving with any sort of exercise, because otherwise you don't get clearance, basically. So this is one of my patients, and he'd just like to tell you a little bit about what he thinks. How can I make him noisy?
Physio is still the most important of the two. If I do not feel well, I'm doing physio. I'm not going for a run and do extra exercise as a way to fix them. Extreme exercise personally can make me cough, can get my lungs with me breathing very hard, which might well loose around, but it doesn't really necessarily clear it, just loosens it.
So basically, if you couldn't hear that, what he's saying is that if he found both exercise and airway clearance are quite good, but if he feels ill, he's not going to do any more exercise, but he will do some airway clearance. And what he finds with exercise is it just shifts it all around, but it doesn't actually clear it. So then he has to go and do his airway clearance. So he might as well have just done his airway clearance. And then this is another guy I wanted to talk to you about. So this guy's called Bob. And Bob loves exercise, absolutely loves it. Plays golf every day, walks about 20 to 30 kilometres on the golf course. And he also goes to the gym 4 times a week for some more high-intensity cardiovascular work. And he really hates airway clearance. I mean, he was supposed to complete PEP, and quite frankly, what was the point? And this was his chest X-ray in late 2019, so he's got some kind of bronchiectatic changes and some nice mucus plugging. And then this is his kind of spirometry timeline from our tracking device that we have. And you can see this here, which is where he started ETI. So his FEV1 was 61% before he started, and it went up to 83% when he was kind of on ETI. And of course, completely stopped airway clearance, was like, I'm so good, there is no way I need to do this, don't even ask me. But kept up with his golf, kept up with his gym work. And you can see the slow slough down of his lung function. So he didn't stop anything else, he didn't stop his ETI, but his lung function just kept going down. And his FEV1 at the start of 2023 was 60%. His chest X-ray, I think that you can hopefully see the exposure's a little bit different, is basically the same as it was in 2019. So he's on these amazing modulator medications, but his chest X-ray really isn't much different. And he's still got quite a bit of plugging. And so we spoke to him, we showed him his scans, we said, look, we know you hate it, blah, 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 please try some airway clearance. So he restarted his PEP. And his FEV1 is now 72%, which 12% increase, I mean, some people, market drugs on that. So, just saying. So, in summary, exercise does improve the ease of expectoration over rest. We do have evidence for that. And quite frankly, yes, it's easier to pour the ketchup if you shake the bottle first. We know that. But exercise does not create an expiratory airflow bias. It does not help the sputum come up and out. And, as these two brilliant systematic reviews have shown, so, Nathan's work and also the work from the Cochrane group, there is insufficient evidence to conclude if exercise is a suitable alternative to airway clearance. And from Tiffany Dwyer's work and from her systematic review in 2021, huffing is advised after exercise sessions to ensure clearance because exercise will not do it on its own. So quite frankly, they do not do the same job. Thank you very much.
Thank you, Gemma. Before I get started, I wanted to take a moment to thank our fabulous session chairs. I've done a lot of these sessions over the years that I've been coming to NACFC, and this was by far the most organized. You guys held us accountable. We had a lot of meetings to prepare for this. I hope it's coming across to you all the work that these two put into this, because they've done a fabulous job. So thank you. And now back to the task at hand here. I think Lisa did a pretty good job showing us that exercise does have an impact on lung physiology, and it can do airway clearance. And Team Airway Clearance, you're doing airway clearance. Good job. But is that all you've got? Because exercise can do a whole lot more. While we're working with our patients and getting them to exercise for airway clearance, we get a whole lot more. And I don't quite have time to read through all of these benefits because they only gave me 15 minutes to speak today. So I'm not going to read through all of them, but I will highlight a number of them as I go through my slides. Most of all, exercise is fun. In this study by Gwyneth Davies and colleagues, they surveyed over 900 people. About 2/3 of them were either people with CF or caregivers or friends of people with CF. The other third were healthcare providers. And in both the people with CF and their caregivers and the healthcare providers, guess what they rated the most burdensome? Airway clearance. They also, for healthcare providers anyway, about 4% felt exercise was burdensome for people with CF. But guess who didn't think exercise was burdensome? The people with CF. They do not find exercise to be burdensome, but they definitely find airway clearance to be burdensome. And let's talk about treatment burden. People with CF often have a lot of medications that they have to take. And then some people want to add airway clearance to that also. And what does that do? We see a decline in mental health. This is real. The treatment burden leads to increased rates of anxiety and depression. And while some degree of anxiety, the experts say some degree of anxiety may be good because you're kind of anxious and you're going to go and get your treatments done, depression is not. Depression is associated with poor adherence, avoidance of clinic visits, greater morbidity, and earlier mortality. And that's not all when it comes to mental health. Now, in this new era, some people are experiencing rapid weight gain. We're seeing negative body image and disordered eating. People have financial concerns about the future. Not only do they have to buy different clothes because they have a different body size, but they have to think more about the future, marriage and family planning. They may have had loss of disability, missed opportunities on education and career planning. Guess what? In CF, exercise produces positive physiological change, including improved body mass. And there's a strong positive correlation between high levels of physical activity and both emotional health and overall quality of life. So again, while we are exercising, and I heard Team Airway Clearance is in favor of exercise, while we're exercising for airway clearance, we're getting all of these additional benefits and improving quality of life. Here's another look at things. This study, they had 134 people looked at these measures before they went on Alexa, Teza, ivacaftor, and then again 12 months after. And while there were some favorable changes, including a decrease in random blood glucose and hemoglobin A1C in people with cystic fibrosis-related diabetes, there were some unfavorable changes. And let's look specifically at these: overweight, obesity, and hypertension. Guess what helps to manage overweight and hypertension? Exercise, right? Some other known complications in people with CF, micro and macrovascular disease, known complications such as retinopathy, peripheral neuropathy, and we know that repeated hypoglycemic episodes can lead to more of these macrovascular complications: hypertension, coronary artery disease, stroke, So again, we can use exercise to help manage blood glucose and minimize the risk of vascular complications. I probably don't even need to include this slide on here. The effects of a sedentary lifestyle are well known, and sitting and doing airway clearance promotes a sedentary lifestyle. So let's not promote sitting around. Let's get our patients up and moving and help to mitigate these other risks. So, in addition to decreasing the risk of multiple chronic conditions and premature death, and possibly decreasing the risk of certain cancers, I think the choice is clear here, which option we need to choose. Speaking of cancer, like pulmonary disease aside, one of the most notable late complications is the development of GI cancers. There are increased rates of colorectal cancer in people with CF compared to the expected incidence in the general population. That's a 5 to 7-fold increase. And in people who have been transplanted, it's more than a 25-fold increase. Additionally, 50% present with adenomas compared to 11% in the general population. We're also seeing an increase in esophageal, pancreatic, and gallbladder cancers. 2016 meta-analysis of over 120 studies, those engaging in the highest level of physical activity had a 19% lower risk of colon cancer than those who were less physically active. By exercising to help with airway clearance, we can also decrease the risk of cancer. Again, which would you choose? This slide is kind of busy, so if you aren't familiar with it, on the y-axis is muscle strength, and across the x-axis is age. This is a conceptual model by Gruet and colleagues. The blue line that's close to the top is based on evidence, and this is the general population with normal levels of physical activity and sport participation. And you can see that there's a kind of a steep increase in muscle strength through adolescence that continues through the 20s. And then after about age 30 or so, we start to see a decline in muscle strength. That's the blue line, that's non-CF with normal activity levels and sport participation. The purple line closely mirrors that. This is people with CF, high physical activity levels with early and sustained resistance training and sport participation. The green and the red also represent people with CF with normal physical activity levels and low sport participation, and then the red is sedentary lifestyle. So we see this big drop in strength. So it's important that we get people with CF engaging in sport early, resistance training early, and help them sustain it through life so we can not have this big drop off in muscle strength, because you're probably well aware we need our muscles to function. We need to stay strong to be able to live a good long life, and that's exactly what we want for people with CF. Another well-known benefit of exercise is improved bone health. These data are from the US CF Foundation Patient Registry, looking specifically at complications of CF. So let's zoom in on what's going on with the bones. Nearly 30 or more than 30% of people with CF have some sort of bone disease. And we can expect this number to continue to rise as people with CF are living longer, especially if we don't intervene. We need to get more people exercising to keep their bones healthy. Another look at bone health. Again, this is just showing the increased incidence, the part of the graph that's on the right, age across the bottom, and then percent of individuals who have some sort of bone disease. So by about age 55, 60, 50% of or more people with CF have some sort of bone disease. And I did, not a very thorough, but I did do a lit review, and I could not find any evidence to support airway clearance helping with bone health. This is probably one of my favorite graphs ever. The one on the left here, this looks at how the number of children and adults in the US with CF Across the bottom is years, so we start at 1992 and then come all the way across to 2022. And in green is children living with CF, in blue is those over the age of 18 with CF. And what you can see is back in 1992, it was mostly children. Today, we have a lot more adults than we have children. This is pretty well known. People are expected to live much longer. People born between the years of 2019 and 2023 in the US can expect a median predicted survival of 61 years. So we have a lot more people getting a lot older with CF. So aging is another thing we need to think about. And I know this slide is quite busy. I don't expect you to read everything, but just a quick orientation to that list there. These are all the things that happen with aging. We have changes to brain function, cardiovascular function, lung function, and so on down. On the left side are arrows pointing up or down, basically saying what happens to that category as people age. And on the left is people who are less physically fit, and on the right, the arrows show the people that are more physically fit. So improvements in neurogenesis, neurodegeneration, lower blood pressure, better ventilation, better gas exchange, more muscle strength and power, all kinds of positive changes in people who are more physically fit as they age. So again, if we're exercising for airway clearance, we're getting all of these bonus effects as well. And just a quote from the World Health Organization as I approach the end of my slides here. Maintaining healthy behaviors throughout life, particularly eating a balanced diet, engaging in regular physical activity, and refraining from tobacco use all contribute to reducing the risk of non-communicable diseases, improving physical and mental capacity, and delaying care dependency. And I think we can probably all agree that we want our patients with CF, our loved ones with CF, to live long, healthy lives with good physical and mental capacity. Exercise will contribute. So, Team Airway Clearance, you promote the sick role, you add treatments, and you add to the burden of treatment, therefore making mental health worse. Meanwhile, exercise does airway clearance and all of these other things. Most importantly, exercise is fundamental.
We're now going to invite the teams up to do a rebuttal in reverse order. So Lisa is going to present for exercise first.
How should I get this back? I'm coming up first because I need to get in quickly before Gemma and Claire delve into the dregs of the world and find more stuff that I've contributed to.
It's just too easy, Lisa. Put it out there.
So they have 5 minutes to rebut.
Right, and because we didn't know what they were in, I have some notes, and obviously this is just an opportunity to remind you who you really should be voting for and get some further evidence in to support exercise. So what about the FET? Well, before we get to that point, I want to just come back to breath holding and equal pressure points. Well, I don't know if any of you have ever done resistance training, and I was trying to think about an answer to that when they were talking. And when I do weight training, I take a big breath and I hold it for a second, and then I actively let go as I push the bar up. Is that not like breath holding and an equal pressure point? So I think it is. So that's that point. And forced expiration technique, when you Google it, and again, like Gemma, I didn't write down other bits, but I did Google what was the forced expiration technique and tried to find out what the definition was. And it involves the active and forceful exhalation of air from the lungs. Well, just described how it happens with resistance training. And when you're running, endurance or sprint training or any kind of physical activity, we're kind of doing that. We're taking a bigger, deeper breath, as Gemma's son pointed out for us. I mean, we're knowing at young age now that that's what exercise does. I mean, that's great. I mean, starting them off young, let's everybody do that, please. And then we're actively exhaling, we're forcefully exhaling the air from the lungs, and we're generating a shear, which is what we know is pivotal to movement of mucus, the mucociliary clearance escalator up so that we can expectorate mucus. So we are kind of doing the forced expiration technique in exercise. And it also says the forced expiration technique is effective in individuals suffering from conditions that lead to excessive mucus production. Now, how many of you are struggling with sputum induction these days because of CFTR modulators? Many of our patients had that purge and subsequently have been struggling to get samples for us. So the forced expiration technique works in people with excessive mucus production. People on CFTR don't have excessive mucus production anymore, which we're very grateful for. And also, coming back to the Delphi in the EXACT trial, physios were asked in the Delphi process about what exercise they should do. And they suggested also that the forced expiration technique should be used at the end of it. But there's not really any evidence base to support FET in what does it do? Why is it useful? Well, I couldn't find any. And it wasn't mentioned in any of the other identified articles either. And here's some previous week supporting airway clearance evidence. So, I mean, we have seen it. There are a lot of Cochrane reviews. And before they get one out, I have done one myself. You can see that one there. That's got me on it too. And last year, it showed that there were short-term benefits to lung function when airway clearance techniques are used. But CAN's just proved a long-term benefit to being physically active. And in 2019, there was no single airway clearance technique superior. But people with CF should choose the airway clearance technique that best meets their needs in relation to comfort, convenience, flexibility, practicality, cost, or some other factor, which we're going to go for the fundamental there, because it is more fun and people with CF will choose what suits them. And that seems to be, as we've seen from the other studies, that they're choosing exercise over airway clearance. Oh gosh, coming quickly to quality over quantity, and thank you very much, Emma, I don't know if she's here, but for your lovely talk earlier today, and who really just proved to us that actually, if you do physiotherapy with PEP or OPEP badly, it's as good as not doing it at all. So no benefit to performing airway clearance, irrespective of frequency. And that's not true with exercise, because a change in mucociliary clearance post-exercise may not be seen immediately, see Emma now, but can occur up to 20 minutes post-completion. So don't discount the efficacy of physical activity straight away. Wait, then evaluate. And we know, we've heard from Emma, that frequency or however many, the duration of the airway clearance doesn't give you the quality, but in exercise that's different. Some is good, more is better. And taking more steps per day was associated with progressively lower risk of overall mortality. So this is my secret weapon. This is Tonya. She's a British Empire Medal for services to diversity and inclusion during her employment at civil service. And more importantly, and specifically, she's Gemma's patient. She came to my online exercise class. Hope you can hear this one.
Hello, my name is Tonya Hickman. I love to exercise because it rejuvenates both.
Oh, sorry. Damn. How did we get that?
My body and my mind. I feel energized after each workout. It boosts my mood and it helps me to feel strong and confident. But it's not just it's not just about physical health. It's a holistic approach to maintaining a happier and more balanced life.
Thank you, Tonya. And Gemma for the patient provision. We've also seen some of the UK registry data, and I think Gemma showed this data. And this shows really that everything, unfortunately, we didn't see the uplift in exercise as we had hoped for specifically. We didn't see the uplift in airway clearance post-modulators that perhaps they would have liked. Everything kind of dropped down. It kind of shows that our patients with CF are doing a little bit less because they're feeling a little bit better. But exercise still comes up higher than any other airway clearance. The thing with this side, and point out at the bottom that these techniques are not mutually exclusive, and they represent both primary and secondary forms of airway clearance, so we couldn't find out specifically at that point. So Gem and I actually did go to the CF Trust and ask if we can break that down a little bit to see where if exercise was the primary one. And this is what we got back from the CF Trust the other week. So when you use exercise as a primary airway clearance technique, when in 2019 the data was collected, there was 840 people in the CF data registry that did exercise as their primary airway clearance techniques. And now there's 1,182. So that has gone up, and that is testimony to the care that they get at the MDT, but also the impact of CFTR modulators. And, you know, we want to thank the people with CF and their families for consenting to the data, and also to the UK CF registry for allowing Gem and I to access this input to share with you guys today. So this is my last slide. Exercise and inclusivity. Everyone is doing it. I mean, Gemma already pointed out her son. This is Gemma's ex profile. This is just some of our physical activity habits. And there's not one airway clearance technique mentioned. She walks, she runs, she does yoga. God, the woman's an exercise whiz. There you go.
Okay. Okay, so let's go back a little bit. And I was going to say, let's talk about the elephant in the room, but I feel like this elephant is like massive within us, huffing. So huffing changes the airflow in the airways to help move those mucus forwards to the mouth so it can be cleared more easily with a cough. And I mean, I think there are some people in this room that are probably screaming internally, at least at Lisa's idea of, oh, I'm sort of huffing anyway when I'm doing something. No, no, no. Huffing is quite a specialist technique that takes quite a lot of work to make effective. And when it works, it's one of the most effective manoeuvres in chest physio for improving mucus transport. So this is work from Van der Schaans. Quite a long time ago now, but it still stands true that forced expiration and coughing are probably the most effective at clearing that mucus. And in 2022, Trimble's work showed this quite nicely. So he looked at whole lung clearance by airway clearance method, and he looked at huff and cough on its own. So he used that as the control. And then he had the vest, he had OPEP, and he had whole body vibration. And you can see that the whole lung clearance is pretty equal between all of them. There were no significant differences between all of them. So huff and cough held its own against all the others. Huff and cough was also included in all the others. And then, if we start to ask the experts about exercise and about huffing. So this, Lisa's obviously mentioned already, was an international consensus statement on exercise, which was created in 2021. 38 people with CF experience together of 479 years. And of course, Lisa was part of this. And they did not say that exercise could replace airway clearance. They said that exercise with huff or cough improves mucus clearance, although there's no evidence. And they would not agree anything else. And I know that because I was also on it. And it just goes to say that they would not allow exercise on its own. And then Tiffany Dwyer did a systematic review in the same year. And she just spoke about the studies that were out there. And just to say that the ones that included huffing with airway clearance and with exercise didn't have much difference in how much mucus was cleared. But if they did not include that huff, then the amount of sputum cleared was much worse with exercise. So again, going back to the question that we're debating, does exercise do airway clearance? No. And then the exact team, they asked the same question again 2 years later, and Lisa again was part of the study too. And they asked all the experts, Lisa's obviously spoken about this study, these sort of questions. So can the right kind of exercise loosen and move secretions? Yes. People agreed it could loosen. But they also said very clearly that coughs and huffs are needed to remove loose secretions and must be included for exercise to be effective as a form of airway clearance. And so we go back to normal exercise. do you huff in normal exercise? I mean, you've seen, on my Twitter, apparently, I do loads of exercise. But do I huff with any of them? No. No, I don't. And I, can go out for a run or I can do something, but I do not huff. So if I'm going to start huffing, that is an active choice to start adding that in, to start making my exercise airway clearance. And then you start thinking about airway clearance maybe becoming trickier. Okay, but exercise makes you cough, right? So even if you're not going to huff, it makes you cough. Again, no. So this is work from Tiffany Dwyer. It's all right, Lisa, you're not this one then. But what it showed was that in terms of how many coughs, yes, exercise gave more coughs than control and doing nothing, so 13 coughs, but it gave far, far fewer coughs than doing airway clearance. So it didn't make you clear your secretions. And then we get to exact. And they've added in airway clearance to make exercise airway clearance. So they've added in those huffs and coughs. You have to do huffs and coughs to be part of this. And you have to have an intensity of airway clearance that makes you deep breathe. So they've made those basic physiological principles, they've put it into what we need to do here. And so we have muddied the water completely. We're now adding in things, we're taking things, we're making exercise airway clearance. And I think pretty much like this guy is saying, is that fun? Not sure it is. And then, in the ECFS, we heard from the exact team, of which Lisa's part of, that exact alone or in combination with chest physiotherapy was regarded as positive, enjoyable, and an acceptable combination. But it has airway clearance in it. So in summary, normal, non-huffing exercise does not do the same job as airway clearance. And we don't have the evidences yet for exact. The studies that are out there from exact so far are feasibility studies. Yes, people are interested in trying to answer the question and trying it out, but we haven't got any physiological evidence as to what that actually does for these people's lungs, for their prognosis, for their long life. And I think if you're starting to talk about decreasing burden, I'm all for that. But I think at the moment, changing your airway clearance for exercise is a little bit like changing my lunch for a packet of cookies. I like it, I'm happy with cookies. But actually, is it good for me in the long term? And I think we can probably all say, nope. Thank you very much.
So you guys get to vote again in about 10 more minutes. Are we making it any clearer for you? Are we changing your mind? Or are you seeing the mud that Gemma had up there on her slide? Okay, so as we head into, I can get it. Another rebuttal here. Let me get my slides up. Project Physio. Lisa glossed over it. If you were in the workshop this morning, you heard about this. User error is a term my husband likes to use with me when I can't get my phone to work or my laptop to work. So Project Physio, really cool project, loads of data, and for those who aren't aware, they attached pressure sensors to airway clearance devices and monitored breath-by-breath analysis in children with CF. And at when this paper was published, there were more than 45,000 treatments, more than 20,000 days without treatments that were analyzed. Conformant, so good quality airway clearance techniques were used in 21% of the treatments analyzed. And this group had significantly higher FEV1. The other 79%, those with non-conformant treatments, no benefit. No benefit. Whether they did their treatment incorrectly or missed treatments, no significant difference in FEV1. And a quote from that study, airway clearance techniques are beneficial when done as recommended, but most people use techniques that do not improve lung function. Most people use techniques that do not improve lung function. So if you're not in that 21% that are doing it correctly, you might as well just skip your treatment, or heck, maybe do some jumping jacks or go out for a run instead, because you will have the benefit of some airway clearance as well as all those other things that we covered. Another topic that we haven't hit too much on here is financial toxicity. And I'm used to hearing cost burden in terms of CF care, and financial toxicity was something that came up in the oncology literature. And then when I was scanning the workshops for this session, there's actually a session tomorrow morning on financial toxicity in CF care. So if it's a topic that's interest to you, you can hear more about it. Financial toxicity essentially refers to the impact of increasing healthcare costs and financial burden on patients when diagnosed with a threatening disease. We know there is a great cost burden or financial toxicity in CF care. People are living longer, we still have complex care regimens, frequent healthcare visits, a number of people are still getting admitted to the hospital, prescription medications, all costly, and for many, not always fully covered by health insurance. Also, what's quite costly, primary mode of airway clearance by many in the United States is the vest, a very costly treatment. Claire showed us that map of the world, and think about those lower income families, where they don't have the means to purchase airway clearance devices. Exercise is free. This cost burden study surveyed over 1,800 people with CF. 64% faced financial burden, including more than half with debt issues. So this is a real thing for people with CF, even in the United States. So just something to think about in terms of choices for people with CF. Also, airway clearance has so few options. We have a handful of devices to choose from. Most of them do cost money. I'll give you that there are some breathing exercises, active cycle of breathing, autogenic drainage, the huff that we're hearing so much about. You have the cost of being taught how to do it correctly, I guess. What about exercise? The options are only limited by your imagination, or by the imagination of your physical therapist, indoor or outdoor, alone or with a friend, at home or at the gym. And while I'd like to point out that the options are endless with exercise, it is so very important to have an educated exercise professional, a physio or physical therapist involved to individualize an exercise program to meet each individual's needs so that we get all of the benefits we've talked about today. Everything mentioned the last time I was standing up here, in addition to airway clearance. There is no one size fits all, so we need to treat the individual in front of us and make sure the right exercises are selected to get the benefits we've discussed. So I'm bringing up this image again because it's very real. Airway clearance, meds, treatment burden, mental health. We can also add in, most of the time it's done incorrectly. We're adding a cost burden, we're adding a time burden. People are coughing and peeing their pants, and I have patients who've had vertebral fractures from coughing, like lots of negative side effects that can happen, ultimately a decrease in quality of life overall. Airway clearance takes away from quality of life by adding the treatment burden, the cost burden, the decline in mental health. Exercise should be used for airway clearance because it not only loosens the secretions, but decreases disease risk, builds muscle and bone strength, and so much more to ultimately improve quality of life throughout the lifespan. Exercise is fundamental. And even my friend Claire over here thinks so. Can you see those images? Regardless of the season, Claire's out there exercising. And I'll leave you with that.
Who knew we were Facebook and Twitter stalkers?
Well, we've heard a lot of things about airway clearance. It's costly, it isn't done properly, there's poor adherence, it's burdensome. Let's talk about that. So there are many options for airway clearance, many cost levels, but we have all of these free options, and it's not limited to just the ones on the screen. There are some options that are relatively cheap. These cost less than $100. Of course, there are costly items, such as oscillating lung expansion, vest therapy, and they might be cost prohibitive in some healthcare systems, but perhaps gym memberships, personal trainers, getting expert advice from your physical therapist. I don't know. Are you giving it out for free? So, the exercise team has described effective airway clearance is key. And the Project Physio group have done some fabulous work, I have to admit, that correctly performed airway clearance is associated with improved FEV1s, and there is a cumulative benefit with more well-done treatments over time. I do admit, their data shows that only 20% of those treatments are conformant, but the group have gone on. They've looked at creative solutions, and for this, the gamification, we've seen that gaming can increase the percentage of treatments that are conformant with recommendations for both breath pressure and length. We're all creative. We can work with this. Adherence is challenging. Any chronic disease management has these challenges, and there are approaches that have been studied to work on improving this, and I don't think it's something that will magically improve, but there are a number of articles that show that you can work on improving adherence over time. Let's talk about exercise adherence. We know that the current recommendation for 5 to 18-year-olds is 60 minutes a day of moderate to vigorous exercise. I'm going to just call that MVPA because it's a mouthful. According to the CDC 2022, only 46% of the general population achieve this. Are we expecting our CF patients to do better than we do? Project Physio looked at the effects of MVPA using Fitbits to monitor heart rate. They enrolled 145 people, but 22% had no weeks where they met the required 150 minutes of MVPA per week. And 10% of their enrollment produced 40% of the weeks that achieved that threshold. So only 10% of us are good at exercising?
Spending too long doing everything.
So the Inspire CF group, their project did a little bit better. They had 53% meeting the requirements at 1 year, 63% at the end of the second year. Girls were less, they're 49 and 58. However, there was no statistical difference between the control and the intervention group, with both showing a mean decline of 1.5% in FEV1 over the 2-year period. And finally, this really well-designed study using a web-based app to improve MVPA with goal setting and motivation had negative findings. 60% of all of the consented subjects didn't manage to log into the app even one time. Another reason that exercise should not replace airway clearance was raised by Lisa at ECRF this year. I'm going to make it a little bit bigger so you can read it. Physical activity disguised as airway clearance may take away the enjoyment of physical activity and reduce adherence. Thanks, Lisa. One of the most important aspects of this debate is the personalized care and how we have to meet our CF patients where they're at. Stage of life, stage of disease, where they live, acute changes. Airway clearance has something to offer in all of those situations. When we talk about age and developmental level, we say it can be considered burdensome, but there are many parents who say the manual CPT time is their one-on-one bonding time. I have personally treated lots of infants that have fallen asleep on my lap. It's not a horrible thing to do. Using some of those cheaper airway clearance options, the Flutter, the PEP, the Acapella, they promote independence, but they still allow the parents to feel that they've got an overview, they can monitor effectiveness and effort. Some of our airway clearance techniques take significantly less time than going for a 10K run. So we can save time here. I think that might improve the burden.
Or waste time.
And we can multitask with airway clearance. We can do our airway clearance in conjunction with some of our other therapies, our inhaled medications. I think there are circumstances where you might say exercise isn't going to fix this. Maybe airway clearance is built different. So to summarize, I'd like to again thank Lisa for her editorial in the European Respiratory Journal. Airway clearance is here to stay.
So those are some very compelling arguments. So it's not over yet, but we're going to take a moment now after the arguments to vote for our winner before we ask some very directed questions. So I'm going to bring back up. So remember, this is our statement. Be it resolved that airway clearance cannot and should not be replaced by exercise in the era of CFTR modulators. And here's our chance to revote. And then I'm going to just switch to the presentation screen, and the QR code will remain. So the question now is, what team are you on now? Oh my goodness, it's tied. 270 people voting. Let's see what happens. $297.
Can we celebrate yet?
Okay, we'll call it in 10 seconds.
Statistical.
All right, let's congratulate Team Airway Clearance.
All right, and now for our first directed question. So, Team Airway Clearance, congratulations first. But it is well documented that adherence to airway clearance is less than 50%, and we know reported adherence is even less than the actual adherence. So, how do you continue to promote airway clearance when adherence is so low?
So I mean, we know that it's low, but we also know that probably exercise is low as well. People kind of say what they want sometimes. I think the big thing is just being upfront with the patients and showing them all the evidence that we have. So, for example, with the case study that I showed, showing the scans, the drop in the lung function, and kind of talking about, what are you doing already? we need to do something because this is not going in the right direction. I think that really helps to have people to have all the information, and then they can kind of they're going to make their own decisions. But I think from my point of view, if I see someone with that kind of lung function slide going on, I'm not going to sit there and go, yeah, great. I'm really glad. I'm really happy with what you're doing, because it's certainly not doing enough. So I think, giving the people all the information they have and trying to discuss it with them is probably one of the best ways of going. Do you want to add anything?
Team exercise, do y'all have anything to add?
I think it's really important, really. Adherence to exercise is very challenging. We all have times where we feel less able and more able to exercise, or times that we don't want to go. So I think strategies that you want to look at are things that build on things like activities of daily living, using a pedometer, step counters, and trying to get your individual with CF to add on maybe 10% in their step count per day, because something is good but more is better. And starting to establish habits like that are really important. It isn't for everybody, but I think, the guys have identified where some of these things do improve things like quality of life and give you a mental health break, which I think is really important. Even with adolescents who are going through exams, sometimes taking a time out, a little break and going for a walk, something like that is good. Having a buddy to help you is also really, really important. And we see a lot of that in the exercise stuff. Having supervised exercise means you will adhere to it a little bit more, but having a buddy that has your best intentions at heart, or motivates you, or you can motivate to exercise, will also improve and enhance adherence. So I think that's how I promote exercise in my clinic. And obviously, we do promote airway clearance as well, but exercise is, and my consultant called me an exercise fascist. I didn't really know what that meant. I had to go and Google it. But I think it's really, it's really important to establish good physical activity patterns in our young children, and they will carry that forward. And if we're good examples as parents, then our children are going to exercise as well. I mean, Gemma demonstrated that quite clearly with her son, so thanks for the tip too.
Okay, we're going to give team exercise the next question to start. So team exercise, putting on your exercise hat, how are you going to respond to questions about the diversity of the population in terms of age and disease status?
I think regardless of age or stage of disease, we need to be thinking about changes, even visit to visit, and checking in with our patients and asking questions and what's going on. As Gemma said, looking at the objective data that we have is definitely important, but also asking the patient the questions, what's fitting into your life, what now, or what are you having trouble doing? Why do you think you're having trouble doing that? What do you think you can fit in? I think whether, from infancy on, we can be promoting developmental play and exercise. But I just want to reiterate the importance of checking in with people with CF, with their caregivers, and seeing what they can handle, what they can manage, and regardless, whether it's exercise or airway clearance, or hopefully some combination of the two, even if it's just a huff after exercise, we just need to be making sure that they're motivated and ready and providing more information and education as needed. But I think that kind of is an across-the-board answer, regardless of age or stage of disease.
Anything to add from airway clearance?
Yeah, I think we really just have to meet our patients where they're at every given intervention. I think being creative, I'm very excited about the work that is being done with the gamification. I think even if people aren't doing what you want them to do, finding out what they are doing and thinking of creative ways of tweaking those things to meet your goals instead of adding. We're just changing minute things, and I think that that's going to be the way forward.
So the life-changing impact of modulator therapy has changed not only the health outcomes, but also the outlook of individuals with CF. This requires a change in how we look at exercise and airway clearance and advocate best for our patients. Before we wrap up today, we are going to hear briefly from one of Lisa's patients in Glasgow, speaking to the role of exercise has played in his life since starting modulator therapy. He does have a thick accent, and just as a reminder, in Europe they call it calf trio instead of tricafta. So.
Hi, just recording this wee video just to give a wee summary of what exercise means for me. So at my worst before calf trio, I couldn't run the length of myself. I was really unwell, and I remember one time specifically was I tried to play football with my pals and lasted like 30 seconds and then was sick, and yeah, it was just really bad. And then calf trio came about, and my lung function went from like the low 40s to like the high 90s, and it just changed my life. So now I play football like 4 or 5 times a week. But I do think exercise is just hugely important to me. I think as well as the obvious health benefits of, you know, the lung function increases and everything like that. It also helps my weight. It makes me hungrier, obviously. But yeah, it's got so many mental benefits as well. So, for example, if I play on a Sunday morning, then I'll come home at the Sunday afternoon and I'll do my chores around the house. I'll probably work a little bit just because I've got that much like energy. I'm happy to go and do stuff. I'll even go to the gym.
And lest you think he forgot his airway clearance, he will also speak on that.
Improving myself. So now that I've got a performance kind of driven mindset, and I know that if I do my physio or if I do my nebulizers, it'll give me that extra yard to run that little bit more to get that ball and, you know, probably miss the goal, but at least have a chance. So yeah, it's brilliant, and it just makes me want to test my lung function, and I'm a lot more on top of my health than what I was pre-calf trio. I think. Hi, I'm just recording this, improving myself. To give a wee summary.
There we go. We want to thank Ryan for letting us share his perspective on exercise and airway clearance. As you can see in Ryan's life, since starting modulator therapy, exercise has become an important part of his daily routine. The airway clearance gives him that extra boost to be successful. It is the first time in the history of CF where we can ethically attempt withdrawal studies, but clearly more research is needed. The safety studies for exact CF are encouraging, but more work is to be done. And in the meantime, we must listen to our patients, find out what works for them, while striving for the best outcomes and balance with quality of life in CF. CF care will always be multifaceted and complex as we monitor and educate across the increasing lifespan.
And so as Jenny and I said in our first introduction, this debate team comes from different healthcare systems, different structures and roles from all over the world. And we considered it an incredible privilege to work together to state the cases for both exercise and airway clearance. But the complementary roles of the physical therapist and the respiratory therapist in CF care is perfectly reflected in the pairing of exercise and airway clearance, which we believe have been shown in this debate, because ultimately you all voted for both in the majority to be shown as the ideal combination for optimal care in CF. And so while more research is needed and practices and opinions will shift over time, we need each other and we need a full complement of core healthcare professionals in each of these roles to ensure the timely, appropriate, personalized, and thorough care of our patients. As we move forward in this new era, let's work together and aim higher for the right care, for the right person, and perhaps this is the right time for exercise and airway clearance to shine. So we're now gonna spend a couple minutes answering your questions that have come through in the app. So,
Okay,
Holly?
great. Sorry. Fantastic job, everybody. I know it might have been hard because I know some of you personalizing at things and having to take a direct stance. But now that the debate is over, I am curious what the panel feels about if you are, I work in pediatrics, I'm Holly Lucen from Johns Hopkins. What do you feel about, though, in this area of Trikafta or calf trio, if you have a patient that now is testing with sweat chloride levels below what would be considered normal, chest imaging looks pretty good and is reporting no sputum. So I heard somebody up there saying in exercise, you don't normally ask us to go and huff. Like, what are we recommending for that group?
I would ordinarily ask them, if they are exercising, that's great. We'd always recommend, with the WHO recommendations of like 60 minutes MBPA for children, and anybody over 18 to be doing 150 minutes of MBPA a week. But I'd always ask them to check in with their chest routinely, whether that be a huff, post-exertional huff, to see if there was anything there. If there's something there, then I would advise them to do some more structured airway clearance, because obviously, as we discussed, like, exercise does move stuff, and sometimes you do need a huff to cough and clear that up. Also ask them to do a huff and a cough in the shower, perhaps, if that's an area where everything is a little bit looser, but to at least check in with their chest once a week, if not more.
And this is more of a devil's advocate question, because I think most of us probably do that. But do we need to? If they're in a normal range and are reporting no sputum on a normal level? Like, that's, I guess, is what my point is, like, what do we think about that? Because all the other examples that were given are people that have like known bronchiectasis, and you're seeing that on the imaging. But how about these young kids that are on it now and are very active, like maybe playing football, soccer? Just a devil's advocate question, more for everybody to kind of think about, but also for you guys to address.
I think, so I don't work in pediatrics, I work in adults, but we have adults that report no sputum at all. And I think you do have to really dig into that and make sure that is really, really the case, because I think sometimes they're used to having, buckets of sputum, and so a little bit, they're like, oh, that's nothing, that's not sputum. But actually there's still something there. So I think some of it is really, really being clear that, they are completely dry. But I would always, as Lisa said, add that check into your chest, just make sure. And I think, along the lines of, there might be some times when they need airway clearance, they might have an infection. They need to know that airway clearance, they need to have it up their sleeve for when they do have an infection. And as, obviously we know from Project Physio, it needs to be good when they do it. So, you need to make sure that they know how to do it. So I would still make sure that people have stuff up their sleeves, definitely.
Yeah, I think I'd like to add to that. I, again, work in adult care, so it's a little bit different, but we have been surprised with the number of patients who have that excellent, 90, 100, 120 FEV1. They don't know how to discern their symptoms anymore. They had their tells before, and now they don't have the same tells. And so we have been caught out on a number of occasions where we're only noticing exacerbations when we do blood work. We're not getting it from a drop in pulmonary function. We're not getting it from symptomology. And so I think it's that conversation.
All right. So some questions from the app. I really liked this one. So Karen, I believe it was in your slide, said exercise should begin at diagnosis. My son was diagnosed at 3 weeks. What, other than tummy time, can I be doing with him?
I do pediatric PT, but I don't work with our youngest patients. I would say there are lots of other play activities. Once they have head control, bouncing on a ball is wonderful, putting them in different positions to promote more muscle development. I might turf it back to my colleague Holly, who works in our infant clinic. Any additional things to add as far as exercise at a very, very young age?
What I tell parents when they're growing up is that your kids going through that first 2 years of development are never in their life going to be as more active as they are then. Every time they're doing something moving, they are challenging their system, they're getting strength, they're getting that. So let them be a kid. So everything you just said, lots of floor time if it's a baby, so they have time to roll, tummy time, side lying. When they get older, working on sitting, getting them up against something so they can stand. And then somebody, Claire, I don't know, Gemma, somebody was talking, maybe it was Lisa, modeling the parent. Best thing you can do as parents is be active. Even when it's a baby going for a walk with your baby, it establishes that exercise is what we do. That's our culture of parenthood. That's how we're going to grow up and be an active family. So I'm sure there would be a lot better responses from everybody else too. But there's so much you can do, but they're doing developmental stuff all the time.
Thank you, Holly. All right, one more from the app. If a patient on ETI could do only one of these for the rest of their life and do it correctly / therapeutically, which would help them live longer and with a higher quality of life?
Exercise with huffing.
And that's a wrap.
That's a wrap. Thank you all for coming. We really appreciate it.